Hi, everyone. It is DocTalk. We're into March. Spring basketball season's here in the NCAAs. Lots of fun stuff happens in the spring. And the good news of this spring is infectious diseases are going away in a big way. And that brings good news for all of us in the emergency service industry. We are at the period of time where usually the respiratory diseases would be heading down. So that's the pneumonias, the asthma that is exacerbated by bronchitis and other infections. And very honestly, we've had a little run of those through the fire services that I am with, and those are decreasing a little bit. This time of the year is awful in many areas of the country with the temperatures on a seesaw going up and down. And that's no fun for anybody, and sometimes sets off respiratory illnesses. But COVID is way down in essentially all areas of the country. This morning's news, 98% of the country is in counties where the rate is low enough that mask mandates are coming off. So let's talk about the wind down a little bit for this week. The wind down, first of all, occurs in our necessity of keeping the hospitals preserved for the sickest of patients. And as our hospital reserves come back up and as our reserves come back up, we can begin to manage our emergencies much like we do on an everyday basis. Think back to 2019. This week, we are 2 years into the pandemic. It was this week that the pandemic was officially announced by the World Health Organization. And 2 years later, we're talking about coming out of it. Next thing that happens is masks for us around each other and moving out into the public become less of a necessity. And so our personnel can begin to think through the process of appearing in the stations with each other and in the vehicles without masks on, and all except congested public areas and in public transportation will be able to take our masks off. In patient care, we will likely preserve our masks for patient care, being both surgical masks on the patient and N95s on us, until at some point we even break that down further and say the N95s only need to appear for patients who have an infectious disease problem. And so fevers and productive coughs and difficulty breathing with the fever, stiff neck and a headache with a fever, that's still something that we always would think about N95s or higher for. And for patients who are coughing, to put a mask over their face. Spring also means we're heading into asthma season. And as we move into that season, many of our protocols that used inhalers in place of nebulizers will begin to disappear also. And we can begin to, as spring allergy season gets here, treat people in the way that we used to before. So the first thing that's coming down is the public health mask mandates. The TSA announced today that the mask mandates in public transportation would be in place for another month. And at Easter time, we'll have two big events occur. One is that mask mandates will disappear in public transportation like airplanes. Number two, the public health emergency. That's conditions laid out by both the federal government and the states that allow them to have less regulation in place and allow a more emergency considerations for operations in the healthcare arena to occur. Both of those will come down at Easter time, which is the middle of April. When that occurs, then local decisions will be made about where we do need to continue to wear masks, if anywhere. And number two, getting back into public transportation, getting the schools back open fully. And at that point, probably in most of the country, we're going to think about spring weather conditions and getting into that. All right, another piece that's important for you all to understand, and I've gotten a lot of questions on this week, is what does test and treat mean? Because a part of the new federal government program is a program called Test and Treat. What the next stage of coronavirus looks like is that locally we'll have lots of places where people who are ill can go and get a rapid test and then get treatments that are coming available. That would be in centers close to major populations. And so if we put those in places like a couple public health spots, but then in drugstores, the mini discount stores, et cetera, we can get those to places where they would be very convenient to people. And rapidly, when they're developing symptoms, they can go and get tested. And if their test is positive for coronavirus, they can get treated. Both of those will be done at public health expense, so they will be free for people who are COVID positive. If they're COVID negative, then another decision needs to be made about what potentially is happening. Is this, a spring respiratory infection from another virus? Is it allergies? Is it sinusitis, et cetera? Another decision made at that time. But test and treat is the next evolution of our management of coronavirus as we go spring and then summer and then into next fall, and disseminating out the ability to test and give treatment to many more places across the country. And in some cases, that allows the federal government to continue to pay the bill for all of this, which is what people will really like. So test and treat may occur. Where we may be involved in test and treat is in places where people can't go and visit. And so imagine that there are places where a lot of people are in senior care facilities or other care facilities, and they need assistance in being able to test and begin to prescribe treatment for them if they need it. So that would be where potentially public health will reach out to fire EMS agencies and say, will you help us? We're having an outbreak of respiratory infections in a certain care facility. We need assistance in being able to go to do testing. Will you assist us in doing that? You know how to use your PPE. We'll provide you with the equipment. We'll provide you with the tests. You'll go out with a team. You'll do testing. And at that point, then a decision will be made about what kind of treatment is needed. And like we have done before in many fire EMS agencies across the country where IV infusions are needed, the really good paramedics in our system can assist in delivering treatments, the monoclonal antibody treatments that are needed in these facilities to stem the outbreak that is occurring there and not have to move all those people out somewhere else in ambulances or buses or anything else. So we may be involved in that test and treat, and I want you to be aware of that. Another piece of news is that the flu is clearly down across the country. It only reached a very low level and is continuing to wane off. One of the pieces of every year in preparedness is getting the injections right, the flu shots right, year over year. Every year a decision has to be made about the 4 or 5 different types of respiratory flu bugs that will go into the flu shot. This year, it wasn't very successful in terms of a match, and that happens about every 10 years that we don't have a good match. You will hear about that in the headlines, that we didn't have a good match for the flu shot for the prior year. And in a couple of weeks is where they will begin thinking about the flu shots that we'll be administering this coming fall. The predominant, really overwhelming number of flu cases this year were from flu A, influenza A, and it was the strain called H3N2. And it happened that we didn't get a very good match for that H3N2 this year. And next year, so six months from now, 7 months from now, when we begin to get the flu shots produced in this country, we want to make a better match available for the coming flu season. It could be a bad flu season this coming wintertime. Just so everybody has heard this, we've been 2 years with essentially no flu in the country. We've had almost no deaths related to flu in 2 years. And no doubt Mother Nature will say, I'm going to make up for that in coming years at some point. So be aware of that and almost think about the flu shot that you're going to be getting in the fall time and how our public health officials working across the globe will be thinking through what the appropriate flu shot ingredients will be for the coming year. So Doc Talk for this week, good news. It's preparedness for spring. It's talking about wind down. It's talking about wind down not only for COVID, but for influenza. And then it's prep for the springtime conditions that are coming, including things like allergies and other things that aren't fun. But boy, is it better than me coming to you with a mask on, talking about worsening COVID. Have a great week. Prepare yourself for good springtime conditions across the country. Stay healthy. Thank you.